let's move on and get started with the reason we're all here. So I'd like to thank Dr. Sophie Lebel for being with us tonight. We're so grateful that you're going to be sharing your expertise with us. So Dr. Lebel is a professor at the University of Ottawa, and she's a clinical psychologist, and she has done a whole ton of research on fear of recurrence, of cancer recurrence. So I know that a lot of people have expressed great interest in this topic, and just want to give a big warm welcome to Dr. Lebel. So I'm going to stop sharing my screen so that you can share yours.
Sure. So thank you, everyone. Thank you, Allison, and thank you, Ovarian Cancer Canada, for having me over. I will attempt to share screen. There we go. So 1 second, and let's see. Oops. Are we seeing my screen?
Yep, I can see your slides.
Perfect. Great. Wonderful. So I apologize in advance if, obviously I'm at home. I have to blur my background because there's children around. I have a loud dog, so hopefully none of that disrupts the talk. So it's a pleasure being here with you. Here's what we are going to talk about. So what is fear of recurrence, and how common is it for people with ovarian cancer and their caregivers? So a little bit of background to start. So we define fear of cancer recurrence as the fear, the worry, or the concern relating to the possibility that cancer will come back or progress. That last little bit, the progression part, I think is really important for you guys. There was a question I saw come in the chat, which was, well, you talk about what happens after you have a recurrence. So my understanding, having worked with ovarian cancer patients, and I'll talk about that, is that people can go through multiple recurrences, and then sometimes they happen progressively quicker. So we're not just talking about that first recurrence, but it could be then your fear that your cancer will keep on progressing. So it's not just, the first time you're diagnosed and you remain recurrence free for a while, but it's all the fear that your cancer will progress. And the tips I'm going to talk about cover how to handle, the fear, whether you've had a recurrence or whether you've experienced a recurrence and you're afraid of having more recurrences. So we say that fear of cancer recurrence is the most frequent unmet need of cancer patients. So an unmet need is a need, whether it's a physical need, an informational need you have, or a psychological need like fear of cancer recurrence, and it's not addressed by your medical team to your satisfaction. So you want help, you need something around this issue. So the most frequent cited one is fear of cancer recurrence, and that is certainly true for ovarian cancer patients. When we look across cancer patients and we see who's got at least a moderate to high level of fear of cancer recurrence, we find that it's 1 cancer patient out of 2. And I don't know if there are any caregivers that are here with us tonight, but for your information, we know that fear of cancer recurrence is just as common and just as prevalent in family caregivers. So a family caregiver could be your spouse, partner, it could be mother, sister, anyone that's taking care of, that's part of your team. Now, one thing that's important to know is that fear of cancer recurrence varies on a continuum from normal to clinical excessive fear. So what does that mean? So I work with a lot of people, of course, who are on the higher end of the spectrum, but a normal level of fear for me would be someone who, on occasion, especially when she goes for her follow-up appointments, on those occasions, during the week leading to that appointment, she experiences some anxiety, she might have more trouble sleeping. She's thinking about that appointment. It's triggering for her. And she thinks about the possibility that cancer will come back. And she has a sense of dread as her appointment comes for her oncologist. And then, hopefully the news are good, and then her anxiety decreases. And this happens, on occasion. That's what I call a normal amount of fear. So pretty much every cancer patient I have worked with experiences a little bit of, discomfort and anxiety around those follow-up appointments. It ranges, of course, to the upper end and where it becomes really a problem. And then, these are the people that I help with in my research. So we'll talk about what that means and how you know if your own fear of cancer recurrence is kind of in a difficult or excessive range. Okay, but just so you know that it's normal to have fear of cancer recurrence. Okay, moving on to next slide here. There. So what do we know about fear of cancer recurrence in ovarian cancer patients? A lot. So the first study here is what we call a systematic review, which is basically a summary of several articles that have been published around this topic. So this is a review published in 2015 of what we knew up to then about ovarian cancer and fear of cancer recurrence, summarizing over 15 studies. What the systematic review found was that fear of cancer recurrence was very prevalent, regardless of the age of the ovarian cancer survivor or stage of disease. Fear of cancer recurrence was especially prevalent among women with ovarian cancer around follow-up visits. And not surprisingly, women reported not receiving adequate support around this fear. The second study was published just last year in 2021. It comes out of Australia. It's a very large study of 219 ovarian cancer patients and 78 caregivers. What I want you to know is that in this study, they looked at sort of what people were saying, at the language they use around their cancer, and they found that for some, fear of cancer recurrence meant a disrupted life, isolation and distress. But, and this is a but I want to mention, not everyone experienced this. There are others who managed their fear of cancer recurrence. Specifically, they found that coping styles and social support protected some women and some caregivers from these fears. So social support is the support you receive from your family, from your medical team, from friends. Coping styles, so some coping styles that people found helpful was acceptance, for example, trying to keep a fairly positive but realistic outlook on life. And again, the study also found that caregivers were affected with fear of cancer recurrence. And if there are any questions around caregivers, I'll be happy to talk about that topic during the Q&A period. Now, the good news is this is our own work. There are interventions that help fear of cancer recurrence, and it's based on this work that I'm going to give you some tips and tricks in a little bit. So this is a study we did that included women with ovarian cancer in the study. So it was the beginning of our work where we did what we call a pilot study, so sort of early work. So we had 56 women with breast or ovarian cancer, stages 1 to 3. They completed an intervention called FORT, for fear of recurrence therapy. It's a 6-week group intervention. At the time, it was face-to-face before COVID, and it was really targeting fear of cancer recurrence. And women who participated in the 6-week intervention reported lower fear of cancer recurrence right after they completed the group at 6 weeks, and then also 3 months later when we surveyed them again. They also reported lower cancer-related distress, better quality of life, and also using better coping strategies to manage their fear. When we looked at whether they had improved enough to say that we could say that they had significantly improved, yes, over 70% of our participants had significantly improved. To me, one of the findings that's most interesting is that their fear of cancer recurrence, when we asked them more questions about, hey, what helped in this intervention? They said, many things were helpful, but the fear of cancer recurrence did not disappear. It's not like they never experienced this fear, but when they did, it was for a shorter amount of time and it became manageable. So who is at risk of experiencing problematic fear of cancer recurrence? And let me just go back 1 second. I'm wondering if there's a slide that, no, okay. There might be a slide missing, but apologize. So who's at risk of experiencing problematic fear of cancer recurrence? Here, the picture didn't come out super clear, but it's the ESAS, so the Edmonton Symptoms Inventory. So probably some of you, I know the ones, the people in Ontario, you have to complete this every visit. So or you might be completing the distress thermometer in the list of problems. So it asks, are you experiencing any drowsiness, shortness of breath, diarrhea, nausea, fatigue? And you answer yes, no, on a scale from 0, not at all, to 10. So we find that the more people have these physical symptoms, and either from the cancer itself or the treatments, they have side effects, the more they report that is physically bothering, then the more fear of cancer recurrence happens. So the way we think about it is, it's normal for you, once you've had your cancer, to be paying attention to your body and to be looking for signs and symptoms that something is wrong, right? You're more in tune, perhaps you're more vigilant about your body. So the more things you have that are happening in your body that are side effects, the more you are likely to think that this could mean cancer has come back. We also, and many studies have confirmed that younger patients are more likely to report fear of cancer recurrence. We think that's because younger patients, in general, younger women, younger patients have a harder time dealing with cancer. There's lots happening when you're a younger woman in terms of younger dependent children, managing careers, difficult decision, financial impact, just feeling like this is happening at the wrong time in your life. This is a question I get asked a lot, not just by patients, but also by medical folks that I work with. Is it that the greater your risk, your actual risk of cancer recurrence, then the more likely you are to experience fear of cancer recurrence? So that we could expect, for example, that somebody with stage 3 ovarian cancer is more likely to report fear of cancer recurrence than someone with stage 1. I know it's not very common, but it does happen. So what's the relationship here? Actually, there is no relationship between higher actual risk. So the number that your medical team, your oncologist may have told you about your chance of recurrence, so that's your actual risk, the number you've been given, doesn't predict your actual fear of cancer recurrence. So I've worked with many people who have, for example, had only like a 5% chance of recurrence, and they were very preoccupied with that 5%. What matters is what I call your perceived risk. So there's the actual factual risk that your oncologist has given you, and then there's what you think is going to happen to you. That's what I call your perceived risk. So your perceived risk could be very different. So these same women who had like a 5% recurrence rate told me, I know what my number is. I know it's 5%, but I'm 100% convinced that this is going to happen to me. So that's your perceived risk. And that's the number that drives fear of cancer recurrence. So of course, if you're 100% convinced this is going to happen to you, you're more likely to experience a high level of fear of cancer recurrence. All right, there's a slide I was looking for. How do I know if my fear is what I called normal before, or kind of excessive, and maybe this is something I need help with? One, I think of the first clues is if you feel like you need help with your fear of cancer recurrence, that's all you need. So if you think, yeah, I think I need to do something about this, then by all means, we'll talk about where you can get help for that. But that right off the bat would be a good enough answer. If we sort of dive into it a bit more, how would you know if your fear of cancer recurrence is excessive? So here's what we found so far in some of our studies. If you're having thoughts that won't go away, that keep on coming back, what I call intrusive thoughts, you're not trying to have these thoughts, they keep on like coming in when you least want them to happen, or you might be having images or worries. Worries are the what ifs. Well, what if I get this, and what will happen to my partner? Then what will happen when I tell my children? Then this will happen. So those worries, and you find them hard to control. So they keep on coming back and they're hard to control. And really key here to distinguish between kind of normal and when fear of cancer recurrence becomes a problem. These preoccupations, these worries are happening outside of appointments, test results. So I told you it's normal to have some worries around when you go for annual or whatever frequency your follow-ups are at. That's normal. But if you're having them most days outside of these appointments, to us, that's a clue. Another clue is people who are repeatedly, so most days, I guess, concerned about physical sensations in their body and think that this means, and they're pretty convinced this means that cancer has come back. Okay? That's another clue. And also, and all this is in the past 3 months. So this has to be pretty consistent and be lasting for at least 3 months. You find yourself seeking too much reassurance. So it could be reassurance from your partner, your family, it could be reassurance from your family physician if you have one, from your oncologist. So I've had patients who are like, my oncologist said I only need a scan like in a year, but I want to scan in 6 months because I'm too nervous to wait that long. And the oncologist said, okay, fine, we'll give you a scan. You don't need it, but we'll do it. So that's what I call extra reassurance. Or you might be spending too much time on the internet. Now, what too much time is of course very subjective. So if you feel like, well, maybe I'm spending too much time and it's not helping me, that could be a clue. I've worked with people who were spending 2-3 hours a day researching clinical trials, symptoms, treatments, drugs, and so on and so forth. Basically, if you feel like your day-to-day life, your ability to go back to work or to make decisions, to plan for the future, to plan trips, to plan events, your romantic relationship, your relationship with family, friends, if you feel like your day-to-day life, your sleep is impacted, that's another clue. All right, so that's for when to think about getting some help for your fear of cancer recurrence. Now getting to the bit that you're probably all interested. What can you do to manage your fear? So I think the most important thing that one can do is normalize this fear. So this is a normal fear. You're not crazy. I always say this is not like a phobia of spiders or elevators. You have normal concerns about a difficult situation. Let's see what we can do to make it more manageable. I think talking, finding supportive others. I'm assuming most of you are part of some sort of support group or supportive community, online community, and I think that could be quite helpful. Self-care, whatever that means for you, whether it's meditation here, yoga, physical activity of any kind, journaling, gratitude journaling, spiritual belief, whatever self-care is for you, I think is an important part of the toolbox. And then this one is for a question that I got in advance. The question was, how do I know what's the best indicator of recurrence? Is it my CA-125? Is it a scan? How will I know? These are really common questions. And I find, and we found in our studies and our interventions, one thing that helps women deal with fear of cancer recurrence is getting accurate medical information from their team. You're dealing with a difficult disease. The symptoms might be vague. I know the symptoms were probably vague for ovarian cancer when leading up to your diagnosis. A lot of people I work with weren't sure what their follow-up care consisted of, when they should be asking for, what they should be reporting, what they should be looking for in terms of signs and symptoms, who was in charge of their follow-up care, why they needed certain tests or not, why weren't they getting a scan, why were they getting this or that. So I think it's important. It reduces the uncertainty. Cancer is full of uncertainty, but the better and clearer information you can get from a trusted medical source, this sort of decreases the uncertainty. You know what to look for. You have a game plan. You know who you should contact. This is going to help. So to answer that question, what's the best way to tell if you've had a recurrence? That's a great question to ask your medical team, because then you know what should you be focusing on and what's something that maybe is less important to be concerned about. So I would say that is definitely something to do to the extent of your ability, because for some people getting that information is difficult and scary. So to the extent you can, getting clearer information will reduce the uncertainty about what's happening and will be helpful. For those of you that are considering getting treatment for their fear of cancer recurrence, their worries, there's really good evidence out there from top of the line studies called meta-analyses, where we pool the results of several studies together that show that forms of therapy that we call cognitive behavioral therapy, so where we look at your thoughts, sometimes just called CBT for cognitive behavioral therapy. We know that that's very helpful. Or something called mind-body interventions, such as mindfulness, for example, where you just learn to let go of certain thoughts. Either in group or one-on-one format will work really well to reduce fear of cancer recurrence. And these interventions are brief. So our intervention was 6 weeks, and the average intervention is between 6 and 7 weeks. So we're not talking about months and months of therapy. This could be handled fairly briefly. Other tips that I have for you tonight. So this one might be difficult, but it's about trying to think about how else you could cope with your fear of cancer recurrence. So remember what I said, the fear of cancer recurrence might not go away, but you can learn to manage it better. So one of the things you could try to do is decrease the amount of reassurance seeking. So ask yourself, is it helpful for me to be online right now? Am I getting access to good information, or am I sort of going down like a rabbit hole and then getting into more and more scary things? Could you decrease that? So most people I work with kind of sheepishly looked at me and they were like, yeah, I know this internet thing now. It's not good for me. Okay. So if you feel like maybe this is not helpful, that's a clue. That's a sign that perhaps that's something you need to decrease. Most people I work with, what they needed to work on is their avoidance. So avoidance is when we're scared of something and we run away from it. We try not to engage with it. So let's say I'm afraid of dogs. I avoid dogs. I avoid parks where there's dogs. So what's going to happen is that my fear will quickly decrease when I don't deal with it, because then I'm just not managing that. I'm just not dealing with it. I'm avoiding it. Unfortunately, what happens, just like my fear of dogs, if I don't confront it, it's just going to come back. And sometimes it grows bigger over time. It becomes even scarier. Most people I work with, I would say that was their go-to. Avoidance or something related, which was just keeping themselves very, very busy. So I have people tell me, Sophie, I've got a packed agenda from morning to night. It's jam-packed. I don't have time to think about any of this. But at night, when I have to go to bed and I can't keep myself busy by doing this, this, and that, that's when the thoughts catch up with me. And I'm having a hard time sleeping and I just stay in bed worrying. That's difficult. Okay, so we'll talk about ways you can open that scary box. So it's a bit of a paradox, but the more you try to avoid, the more this is going to become difficult. What we're talking about is going towards looking at things, looking at that scary box, accepting those thoughts. And I'll get into that in the next slide. So you can try more helpful coping strategies. So if any of you here are doing meditation, yoga, any such things, that's great. Keep doing that. So acceptance, which doesn't mean like, yay, this is great. Acceptance just means you are dealing with what is in the present moment and doing your best to stay in the present moment and face what you're facing. You can seek social support, as we talked about before, from people that you feel will give you a welcoming and a good listening ear. You can, and mostly what I would encourage people to do is taking small steps to open, and I really did like a little open box here, opening that scary box. I don't know if there's people here that are fairly recently completed treatments, but a lot of people I work with as a clinician come to me and they're like, wow, I just completed treatments, or it's been a bit of time and I haven't unpacked anything. They tell me, I just took the whole experience, I put it in a box, I closed the box, I put the box under the bed, and I haven't looked at anything. What just happened to me? So my job as a clinical psychologist is to help them tolerate. Let's open that box and look what's inside together. Right? What I get a lot from people at first, when they first join our studies, they're like, oh, Sophie, but what if I could just control my thoughts? Can you teach me to just control my thoughts? Because if I could just get rid of all these thoughts around, the recurrence or the progression of my cancer, then I wouldn't be fearful because I'm just not having these thoughts. So what I need from you, Sophie, is tools to just not think about any of this. Guess what? Unfortunately, that's going to be very challenging. And I'm going to demonstrate that by asking you to do an exercise. Okay? So if you feel free to use the chat here and just say yes, no. So what I'm going to do is I'm going to do what I call the pink elephant exercise. So what we're going to do is I'm going to count 30 seconds. I'm going to give you a couple of warnings as we approach the 30 seconds. And during those 30 seconds, I'm going to ask everyone to focus and to really focus on blocking all thoughts of pink elephants, okay? Thoughts and images. So when I say go, you're going to block those thoughts of any pink elephants. You can put in the chat after the 30 seconds are up and say, oh my gosh, I saw elephants, or no, I managed. All right, so I'm going to start in 3, 1, 2, 3, go. Block those thoughts. 20 seconds. Block those thoughts of elephants. Last 10 seconds. Keep those images out. Okay, your 30 seconds of elephants are up. If you feel free, if you feel inclined, please tell me what happened in the chat. Did you manage to block the elephants, or instead, did you get this? Okay, so if you got this and you're like, oh my gosh, how come I wasn't able to control the elephants? It's because it's scientifically impossible. There are a couple of exceptions. I'll talk about that. So a lot of studies have been done and show that what happens when we try to suppress a thought, like really block it out, the thoughts multiply. They just become bigger and bigger, and you have them more. Okay, so if this happened to you, and I also like prompted you a couple of times and said, don't think about this, then you're likely to experience this. If some of you were able to, kudos to you. Usually what if we were like, if I could see you and I could ask you directly, I would ask you, so how did you do that, Susan? And Susan would say, well, I thought about my cottage really hard. Like I pictured myself going through my cottage or my house, and I pictured every room where I really focused on some sort of detailed something. So great, Susan, you were able to do that for 30 seconds. So usually there's, and anytime I do this demo, there's a couple of people that can do that. So good for you, Susan. So you're able to do that for 30 seconds. Was that hard? Oh yeah, I had to focus really hard. Okay, well, imagine having to do that for hours, not for days, not for weeks, so that you can really block all these thoughts. Would that be sustainable? No, it wouldn't. It would be very hard to do. So Susan knows she can't do this for an extended period of time. And also, while you're focusing on your cottage, imagine you're with other people and you're really trying to block all these thoughts. You're not quite fully there. You're really spending so much energy just blocking those thoughts out. Okay. So instead of blocking the thoughts, what should you do? Okay. Well, here are some things that you can do if you're trying to block the thoughts. Remember that there are probably many occasions in your life before your diagnosis of cancer where you successfully managed uncertain times. You probably managed to choose, careers, jobs. You probably changed jobs or careers at some point. You completed school, whatever form. You chose certain paths. You got into relationships, ended relationships, you decided to have children, perhaps, or not. You dealt with all kinds of uncertainty. Maybe you had a prior experience of managing illness, yours or someone else's. So you were able to manage difficult times in the past. So what helped you then that you can use now? A lot of time I work with people who have such harsh languages towards themselves. They're like, pick yourself up by the pants, Dawn, and you'll just get through this. And I have to ask them, would you tell that to your best friend? Is this how you would speak to your best friend? And they say, of course I wouldn't. So I encourage you to learn to pay attention to your thoughts and to practice kindness. You're already struggling. There's no need to make yourself feel worse by saying, sort of being rough towards yourself. In our studies, we teach women to come up with what I call a mantra, or sort of a calming self-talk phrase, such as, I'm doing the best that I can. One of my personal favorites. Some people use something like, a thought is just a thought. This is not happening right now. This thought is not helpful to me. When they have this fear of cancer recurrence, I'll cross that bridge when I get there, right? You're not experiencing the recurrence now. This is not happening now. I'll cross that bridge when I get there. Okay. I'm doing the best that I can. I can cope. I can handle this. So something like that you can repeat to yourselves, and that you believe, of course, in moments that are difficult. And I would say aim for an amount of worry that is good enough according to your standards. So what I mean by that is we don't want to get rid of all your worries. Here's what we want from you. So this is a performance and anxiety curve. So think about this as you're preparing for an exam. So here's you at the bottom. You're not particularly anxious or care about the test material. You're not really studying. Performance here, you're not motivated to study. Performance is going to be low, poor. All right. As you get more, sort of engaged, a little aroused, you're anxious, you want to take care of your health. Here, you want to study for this exam. You're going to get optimal peak performance. There might be a time where your anxiety becomes so much that it becomes crippling, right? You become distracted by anxiety symptoms. You can't focus anymore. So if anyone here has ever experienced test anxiety where they froze during exams because it was just too much, this is the part where your anxiety starts getting the better of you. If we apply that to fear of cancer recurrence, here we don't want people who are non-motivated, not paying attention, not following up what the recommended guidelines are for managing their cancer. So we don't want this, but we don't want that. Someone who's so anxious and so preoccupied. I once had a patient in one of our groups who said, I might as well have had the recurrence. I've been thinking about this recurrence every day since I've been diagnosed. It's as if I've been living this recurrence daily. So we don't want this either, but we want you to be, engaged with your medical team, thinking about it, but not here. So think about, the amount of worry you're experiencing and saying to yourself, could I dial it back a little bit? The last tip I'll talk about is perhaps one of the most powerful tools that's come out of psychology in the past 30, 40 years, which is called cognitive restructuring, a fancy term for saying paying attention to your thoughts and talking to yourself back in a way that's more helpful. So this means basically challenge your thinking. So a way you could challenge your thinking is, let's say you're experiencing some sort of new physical symptom, something's off. And then your mind automatically goes, oh my gosh, that's it, it's the cancer that's come back. A way to prompt a different, perhaps more helpful way of thinking would be, could there be an alternative explanation to this physical symptoms besides having a recurrence? Could there be something else that explains this symptom? What else could be happening? So here, as I said, sometimes thinking, what triggered me? Why am I having this thought? You had a headache. That's the trigger, the physical symptoms. Your automatic thoughts, what automatically where the place your mind goes to is, oh my God, I'm sure my cancer is metastasized to my brain. And then you'll have consequences when you have this scary thought. You'll have a sense of dread, you'll be shaky, whatever symptoms of anxiety you experience. And then you have to ask yourself, could there be something else that explains this symptom? What else can I do? Do I have a game plan? Yes, I have a game plan. Am I doing everything I can? There is no sign or evidence that my cancer has come back right now. And you can think about, am I thinking, am I engaging in the best thinking possible for me? Am I doing something like catastrophizing? My mind goes through the worst. So this is a skill that we teach on some of our interventions and that women find very helpful. It takes practice though. As a psychologist, when I was in training, that's something I too learned to do. And I'd be surprised sometimes about, oh, so that's really what I'm telling myself, okay? Here's an example of how we might teach women to challenge their thoughts. So we'll help women identify what's triggering your fear. And commonly people tell us medical checkup. I heard that my neighbor has been diagnosed with cancer. So celebrity X, Y, and Z has been diagnosed or had a recurrence of their ovarian cancer. Okay, so that's the situation that triggered this. What's your emotion? They'll be like, oh, feeling very anxious. What's your automatic thought? I can't do this. I'm not strong enough. I would say, like, really? Do you think that's true? No, actually. I've had many positive checkups. I've coped so far. I've got a good support system. So then we help them come up with a more realistic, or what I call sometimes a more helpful response, which would be, this might be difficult, but I can do this. And then we ask them, what happens to your thoughts after? So usually the anxiety or the sadness decreases. Might not go to zero, right? But with practice and with using good self-care, talking to loved ones, doing different things, when you put it all together, you can learn to manage some of your fears. That sort of concludes the tips and tricks portion. I'm rounding up to pretty much 40 minutes. I just wanted to let you know that right now we have a study going on for caregivers. So any Canadian caregiver of a cancer patient, but we're looking for women caregivers. So if you have someone in your family that you call a caregiver that's identifies as a woman, a person that's caring for you, could be a daughter, it could be a sister, it could be a mother, and you know that this person is preoccupied with your cancer coming back. So I've helped many children who have parents. So these are adults who have parents who are caring for their parents. They're very afraid that their cancer will come back. Often it's spouses here that we have in these groups. So if you have someone in your family that is really preoccupied and is struggling with fear of cancer recurrence, we're now testing these interventions for the first time. This is the first study ever done for people to help caregivers with their fear of cancer recurrence. So I'll leave the email here. So that's, if you have any questions about anything, if you're looking for resources, you want to contact me after this talk, we don't have a chance to get to your question, please contact me at slebel@U-Ottawa. If you have a caregiver in that might be interested in joining our next group study, starts in May, that's the email of the graduate student whose thesis this is. And once again, I want to thank Ovarian Cancer Canada for inviting us. We have done, one study looking at caregivers of women with ovarian cancer, and that was with some help from Ovarian Cancer Canada. So we have a long-standing relationship with you, and we really appreciate it. So that's it for me. I think we are going to take the questions at the end after Andrea, or are we taking them now?
Yes,
Okay,
so thank you so much for your presentation. I just want to assure everyone in the chat that I am monitoring the commentary and any questions that come up, and we'll be sure to have Dr. Lebel address some of that after we hear from Andrea. So yes, again, a big thank you to Dr. Lebel, and we're going to pass over to Andrea now. So she is a 12-year survivor, and she's joining us tonight from Windsor, Ontario, and she's going to share some of her story with you. So over to you, Andrea. Thank you so much for being here.
Okay, thank you. I'm sitting here, my palms are all sweaty and I'm a little scared, but okay. So in 2010, I was diagnosed with stage 1C ovarian cancer. I had no idea that I had any issues. I actually was washing walls, had a severe pain, went to the doctor and found out that I had fibroids. He was not going to let me sit in pain. He said, let's get them out. 2 days later, I was in surgery. 2 weeks later, I was told I had ovarian cancer. About 2 months after that, maybe a little bit longer, we found out from a cousin that she had been doing a study with our family, and we also carried the BRCA1 gene. So I went through treatment. I went to the doctor. The doctor said, well, you've been through treatment. They got it all. Chances are it won't come back. You were stage 1. You're good to go. We'll monitor you for a year, and then from there, you're kind of on your own, which is the most scary thing you've ever heard in your life. So the year went by, and they decided to, my sister was diagnosed with breast cancer, and they decided to do CA-125s for a while. And 18 months after my first bout, I was told that my CA-125 had gone up, but it didn't show anywhere. They didn't know where it was. That was in January, and it took until July till they actually found the tumor, which was single standing by my bladder. The second time we went through chemo, I went through surgery again, and my doctor had changed. I lost my oncologist. He got taken over by somebody else, and he said to me, well, your cancer's recurred, so you have 3 to 5 years to live, and you can get your affairs in order. I think I was 49, maybe 50 years old. I have a son with Down syndrome. I was newly married. I've only been married about 5 or 6 years, and I'm thinking, this is ridiculous. Like, I spent 6 months sitting on the couch, upset and worried, and where is this going to go? And oh my God, I'm going to die because this is what they told me. I decided to take matters into my own hands, and I got in touch with my regular gynecologist who sent me to Toronto. And they said, oh, absolutely not. Let's get this out and we'll do chemo, but we're going to monitor you now. And would you like to be part of a clinical trial? Which I did that. It was an immune vaccine trial. And things went along great. And then 4 years later, I was re-diagnosed again. This time it was on my spleen. We knew in September something was going on. By February, the spot had finally showed. And in June, I had my spleen out and did 6 more rounds of chemo again. So needless to say, in between the 18 months and the 4 years, and now I will be 5 years on October 1st, my anxiety level jumps all over the place. Every time I have a scan, that week between when I have the scan and when I have the report is the worst week in my house. It is absolutely horrific. I am anxious, I am miserable, and I try to do everything that I tell everybody else to do, which is breathe deep, keep busy, but it's still there. The fear is there all the time. And we've learned to cope with it a little bit better. I now have grandchildren, so we spend time with our grandkids, and we try to, I try not to think about it, honestly. I'm on Lynparza or olaparib, and I have a CA-125 every other month now. And I don't ask anymore. I don't ask what my count is. I don't have to have CAT scans every 3 months. Now all I have to do is 6 months, and that was by my choosing. Every time I had a recurrence, I never knew I was in recurrence. The only reason I knew is because my CA-125 showed I was in recurrence, but the fear was always there. And I kind of had a saying, and I tell people that I talk to, I got involved with peer support, and that helped me as much as it's helped anybody else. And I'm sorry if I'm kind of jumping all over the place here. Things pop into my head and I think about it. I got involved with peer support, and the things that I tell people are, not every day is a good day, but there's something good in every day. And it doesn't matter what that something good is, but there's something good. Nobody has put a tag on my toe that has an expiration date. No doctor is ever going to tell me again that I am not going to be here for 3 to 5 years and to get my affairs in order. Every time I go into my oncologist's office now, he says I'm a walking miracle, because he said I shouldn't be here anymore. I've had everything against me, and I'm still here, and I'm still cancer-free. I knock wood every day. I'm thankful every day that I'm still cancer-free. But when I was re-diagnosed the second time, no, sorry, I'm wrong. When I was re-diagnosed the first time, Ovarian Cancer Canada put me in touch with a girl called Christina. And Christina called me and she said, what are you doing? And I said, what do you mean, what am I doing? I finished my job. I worked at Ford Motor Company for 29 years. They offered a buyout. I took the buyout, so I was officially retired. And she said, but what are you doing? And I said, nothing. And she said, you're sitting in your chair and you're feeling sorry for yourself. And I said, yeah, I am. And she said, get out of your chair. She said, every minute that you spend in that chair is a minute that you've lost. And Christina's no longer here, but she's in my heart because she got me out of my chair and she told me to quit feeling sorry for myself. And I think I needed that more than I needed anything else. I've had a wonderful care system. My family has been awesome. I'm not the only one that's had cancer. My sister's had breast cancer. My brother passed away from multiple myeloma at 46 years old. My father had lung cancer. So our family is just full of it, and it's all around us. But we're still here and we're still enjoying every day. And that's what I try to tell people that I talk to is you're here today and enjoy today. Because if you let fear take all of those things away from you, then cancer stole something else. They stole those minutes of your day. and you can't get those minutes back. You can't get those days back. You just try to work through each day. And if the fear comes around, you try to keep busy and do something else. I can't spend my life being afraid all the time. And I'm doing better at it. You can ask my husband that. I do much better at that now. So that's about it for me.
Thank you so much, Andrea. I just have chills right now just listening to you. I'm not sure if
Sorry, I bounced around so much. I kind of get lost in what I'm saying. And
no, it's good. I just want to draw your attention to the chat. There's lots of love coming your way. I was going to read it all out to you, but then more messages started coming in. So I just want to make sure that you see all the love and gratitude for sharing your story. So thank you so much for doing so. And the messages are still coming in. So make sure you take a look at those.
I'm reading somebody's and she says the fear is justifiable, and it is. And if anybody tells you you shouldn't be afraid and to get on with your life, then they don't know they've never been in your shoes. We're allowed to be afraid, and we're allowed to be scared. And, it's cancer. I mean, it's a big black mark on a piece of paper that comes at you, and you can't erase it. It's with you, and it's yours, and you own it, and you're allowed to be afraid of these things. We always get the people in, and I have two friends that are on this board too, Shannon and Cheryl, and they, we try to pump each other up. They're going through chemo right now, and you try to push and pump each other up, but saying, oh, you're strong and you're superwoman and you're going to beat this, and sometimes doesn't always help either, because some days I'm not really strong, and some days I don't feel like I'm going to. And even with 5 years out, sometimes I'm in the middle of a bladder infection, was having horrible pain, and I couldn't figure out what was going on. I'm thinking, oh crap, here we go again. My CA-125 is fine. I know it is. I just had it done. So I just had to back away and, okay, let's see what else is going on. And but we're allowed to be afraid.
Yeah. Well, that kind of brings me, because I just wanted to share a little bit of the themes that were coming out in the chat during both of your talks, and have some of the questions addressed as well. So one of the themes that came up that Andrea, you kind of just talked about, is just people acknowledging that the fear is inevitable, and it's normal to be fearful, and it's very justifiable, and just thinking of ways to manage it. A lot of people shared where they are kind of in their journey, how long since they've been diagnosed, and if they've had any recurrences. So if you want to read about that, jump into the chat. There's lots of people sharing their stories. So one question that came up, Sophie, during your presentation, and I hope I got it at the right time. I think it was during the part where you were talking about the study that talked about factors that will predict someone's fear of recurrence, and how there wasn't really a relationship between the actual fear that the medical, yes, you know what I'm talking about. Someone in the chat asked how come stage 4 wasn't included. I'm not sure if that was the right part in your presentation when that question came up, but I think that's where it was. Maybe
it was about, I think when we did the pilot study, why we didn't take people with stage 4. Stage 4 can mean different things. What we wanted to avoid was people who were in the palliative stage. So not everybody who's in stage 4 is in the palliative stage, I know, of course, but we feel like when you hit the palliative stage, sometimes the issues are different, then your focus is a little different. This was meant for people who are before you go into that phase and you address a different set of needs. My approach for somebody that's in stage 4 is slightly different than what I expressed today. I think there's more room for grieving at that moment. So we're looking at slightly different psychological issues. That's why we didn't have people who were in stage 4. Okay, yeah, thank you for the explanation. So there wasn't a particular question, but I just saw people kind of responding to one part that you were talking about, which was about the catastrophizing kind of concept, that if someone feels a sensation in their body, notices a symptom, automatically jumping to the fear. Right. I read some of the comments, and It's a tricky one because, as I suspect, many of you, I think, wrote, well, my symptoms were vague, and thank goodness I paid attention to them, because if not, I might not be here today. So I think that's a particular challenge for some cancer patients. You have to be mindful of your body, but you can't pay attention or give the same importance to every single symptom that you have. If not, like Andrea said, you might never get out of that chair, because there could be, you could become paralyzed with the fear. So it's about that optimal level of worry I talked about. So how do you pay attention to your body, but in a way that allows you to keep on living and keep on doing the things that are meaningful to you? So of course, yes, I agree. You will know best. And the nurses we work with in these groups always say, if you're worried and if you're concerned, call us. Doesn't matter if it turns out to be nothing, give us a call. That's fine. So I think there's recognizing what your new normal is and not being afraid, but not also being paralyzed with every single physical symptom that you may have.
Yeah, I think that makes a lot of sense. I think that's one of the unique and very, very frustrating challenges of ovarian cancer specifically, is the symptoms can be so vague, and symptoms that we all have all the time for many other different reasons. So I like what you're saying about not jumping to the worst case scenario, and remembering it could be something benign, another kind of explanation, but still, maintaining that awareness of what the symptoms are. Yeah, it's a tricky balance, and a lot of people in the chat were acknowledging that. Victoria asked a question about the caregiver study, and the question was if there are ever going to be studies on men who are caregivers, and if they'll let us know, because there's a lot of men in these women's lives.
Yes. So we've done a survey with just men, and to understand better their needs and their challenges. And I should say, one of the things that came up the most for men was needing to feel more supported by the medical team, needing to feel like they are also part of the medical team. And I think giving themselves permission to have sometimes for maintaining some social activities, which we know is challenging when you're taking care of someone. Men, of course, experience fear of cancer recurrence, obviously, but most of the studies that have been done so far have been mostly with women. So that's why we're focusing more on women, because we know more around that topic. But I agree that it would be important to offer. So next step would be to offer this to men as well, but more women have tended to show up for these studies.
Yeah, no, that makes sense. The feminist in me is just going, yeah, women more often are caregivers, but Victoria brought up the fact that a lot of these people,
of course, yeah,
who are heterosexual and have husbands and male partners, have a lot of men in their lives doing really important caregiver work. Okay, a few things just popped into the chat, so I just want to make sure I get to them. So how do we source more personalized group support on this topic besides off dialogue? Person called me once from Ovarian Cancer Canada early in your diagnosis, never called back. I'm sorry to hear that you didn't get a call back. If you'd like to send me an email directly, I can give you a call, and I'll just put my email in the chat for anyone who wants it. And just so that you'll know, I am the Ontario and Atlantic region support person. So we can always talk. And in terms of personalized support groups, I highly recommend coming to the Teal Teas. It's a great way to meet people and connect and just chat and share information. But if you'd like to email me, I can give you some more maybe personalized advice to wherever you happen to be. Okay, any suggestions on how to get your family support? Oh, hold on, the chat's moving on me. Any suggestions on how to get your family support to allow you to express your fears? Mine are all don't think negative, nothing to fear, you're fine, they got it all.
Andrea, I don't know if you want to address that.
Yeah, I got told that the first time, and I'm reading somebody else's here, and it says, I agree, I've been told it's not if it comes back, it's when.
Mm-hmm.
And the first time they told me, oh, it's not going to come back, but I was still scared. I was scared every day. My fear just went crazy. And on top of all that, and this gets mixed up in this too, those of us the first time, you're thrown into menopause. So you're not only dealing with you've had ovarian cancer and you've had chemo and maybe going back to work or whatever, but hey, let's throw some menopause in there on top of that. And let's really throw your emotions in out of whack while you're in the midst of everything. So yeah, I mean, I've been told now I'm chronic. So it will be back someday, but I'm ready to prove them wrong. I never do what I'm told. So I'm hoping to prove them wrong. I've been on olaparib now for it was 4 years in November, so I'm kind of a long hauler on this stuff. So what was that, honey? Oh yeah. Okay, so my husband's reminding me of one of my stress days. We were sitting in the kitchen and we had a big island in our kitchen, and I have told the story to a few people that I couldn't really get my emotions in check. I was scared. This cancer was in my face. I come back again. It's never going to go away. I'm going to die. That was the way I was feeling. There were dishes on the counter, and I literally picked up 6 dishes one at a time, and I shattered them on the floor. And my husband looked at me and he said, "Does that feel good?" And I said, "Yes." And he walked out the door and he pretty much said, "I'll see you when you clean them up."
I thought he was going out to buy you more dishes.
Oh, no.
But you tell him that's
No.
what you should have done.
If I may, so for people who are feeling like their families are, encouraging them really to focus on the positive, and you find that a bit stifling. We heard that a lot in our groups, where people felt like, okay, my family wants me to move on or just focus on the positive, and I can't do that all the time, or that's not where I'm at. You can explain that to your family. Some family members are open to hearing it. Unfortunately, some are not. If that's your case, I saw in the chat, people are encouraged to join the Teal T, I guess, the Teal Ts. Finding a group of women or people that you can talk to. I think that was one of the main benefits of our studies, is that people felt like, wow, I'm not alone. I'm not the only one with these worries, these fears. Other people get me. I think there's nothing like being surrounded by other people in your similar circumstances to feel like, wow, okay, I'm not alone. And I must say, one of the comments we often get was like, does this really apply to women with ovarian cancer? Because we did the studies with women with different gynecological cancers, with women with breast cancer, with women with ovarian cancer. And there's a lot of questions every time I present to medical professionals also, like, but does this really work with women with ovarian cancer? Because I am aware, I was working with a psychologist who was focusing just in that population of it's not a matter of ifs, it's a matter of when. So we knew that going into it. And despite the much higher risk in a different disease, in a difficult disease, these strategies work just as well for women with breast cancer than they did for women with ovarian cancer. So we compared them. We saw, would it maybe not work as well for people that have, a much more aggressive cancer, much higher risk of recurrence, and the same tricks, the same strategies work as well. I think it's like you said, what are you going to do with your time? So the fear is real. The fear is not something that can be taken away. How are you going to manage the time, whatever time you have? What are your priorities? What are your values? What are you going to focus your time on? How are you going to manage those emotions and that reality? And I think regardless of the stage of cancer is scary, no matter what. So just to say, I think strategies can work for any cancer patient.
One thing I like to kind of add to that, and I don't want to sound like too much like a blind optimist, but one thing we just try to remind people, because the statistics around ovarian cancer can be pretty distressing, is that not one individual person is a statistic. So the statistics might be a little bit rough to read and create a lot of fear, but you as an individual are not a statistic. And we, at the Teal T last week for 10 years plus, we had a woman there who's been diagnosed 35 years ago, never had a recurrence, doing really, really well, working with her family, friends. So no one's a statistic. And I just want to kind of remind people that, because I think as people are sharing in the chat, kind of the grim news they hear from their doctors, and maybe the kind of guarantee, even though there's no guarantee, but guarantee that you'll have a recurrence. Just that's my little optimist plug, I suppose. I see some question in the chat about olaparib funding. I'm going to encourage people again to send me an email, and I can kind of talk to people about that one-on-one. It's different in different parts of the country, so I'm just going to drop my email in the chat again, and I can connect with people one-on-one about those types of questions and individual cases and things like that. Okay, let's see. Are there any other questions here? Again, some people are sharing little pieces of their experience. Funding. It would be really helpful to hear from women with stage 3+ who have done very well without recurrences. So not to plug the TLTs too much again, but if you're not part of the 10-year plus group, you're still more than welcome to come to the 10-year plus group and hear from women who are 10, 20, 30 years out. Some have had recurrences, some haven't. And you can kind of hear their stories and hear from those people and hear that they're doing well. So don't feel like you have to go to the TLT that's prescriptive to you. Come to any of them and hear from different people with different experiences, if that's going to provide maybe some hope or some comfort or help manage some fears. Jody, I see you say my email is not coming up in the chat, so I wonder if I'm just messaging one person directly, and yep, that's what I was doing. So I guess no one's getting any of my messages. Sorry about that. Do you see it there now? Okay. Salwa, yes, it does actually. I actually have my notes from the last meeting, and there were people with more advanced stages who are at that 10-year plus mark. So you're more than welcome to come. You don't have to have had been diagnosed 10 years ago. Okay, so another question. Is there a way to find cognitive therapy or mindfulness that specialize in the PTSD of cancer and recurrence? Can I put that to you, Dr. Lebel?
Of course. So the first place I would start is your cancer center, wherever you are located. Hopefully your cancer center has what we call a supportive care team or psychosocial oncology department, where you might have access to social workers, perhaps a psychologist, a psychiatrist, someone there who would have the background to be able to offer you that kind of therapy. If not, and if you can afford to go and to seek private services, most provinces have a registry of psychotherapists or psychologists, and you could find information to find a specialist with a health psychology background, so somebody who's worked with people with illnesses before.
And some of the cancer programs like ours has peer support, and it can be done through phone calls or email, and also when I was going through a really stressful period, our hospice had a program. Hospice isn't just for dying, it's for living with cancer too. So they had Reiki therapy, and they had yoga, and there was this is all before COVID, obviously, but hospice did have some really good programs for people learning to live, because once you've recurred, you have to live with this for the rest of your life. So it's there, it's in your head. But they had some really good programs for that.
That's great. Thank you, Andrea. Are there any last minute questions or? So I'm going to, if it's okay with everyone, share my screen just one more time with you. Here we go. Okay, so I hope that you can see my screen right now. And it's just letting you know that there is a survey available for you to provide feedback on this session and make suggestions for upcoming sessions and all that kind of thing. It's only 5 minutes, and here's the link to the survey. I'll also put the link in the chat in just a moment. So yeah, your feedback is just very, very important to us, and we hope you'll take 5 minutes just to let us know how it went for you and give us any suggestions for future sessions. So I do apologize if I missed anyone's questions. The chat did go really quick. They tried to get everything I could. If I didn't answer your question or didn't get to it, sincere apologies. Please send me an email, or you could also email Andrea or Sophie if they're open to that. I know you said you were. If you have any questions for them either, if we didn't get to your question this evening. So with that, any closing thoughts from either you, Andrea, or Sophie, before we log off for the evening?
No, thank you for having us.
Oh, thank you for having me, and just everybody live each day. You woke up today, today's a good day. You know, we don't know what tomorrow will bring, but today's a good day. And it doesn't matter, there's something, my motto, not every day is a good day, but there's something good in every day.
I love that. That's really nice. Okay, a big thank you, Andrea, for sharing your story. It's just so meaningful and impactful. And to Dr. Lebel for being here and sharing your expertise with us. We're just so appreciative, and you had just such wonderful information, great tips, and yeah, this was a really valuable session. So thanks to both of you and to everyone for being so engaged in the chat. And like I said, if I missed anything or you have any follow-up thoughts, please send us emails, let us know. And a reminder, the next speaker series is April 20th. We have Dr. Katz talking about sexual changes after cancer treatment. Hope to see you there. Hope to see you at some Teal Teas. And yeah, have a great evening, everyone.
Thank you.
Bye now.
Thank you.